India is seeking a coordinated response, be it at the regional level or at the international level, to try and collectively battle COVID-19, the pandemic. And amid all of this, the Indian envoys, the diplomatic, in fact, missions, they are playing a very crucial role in trying to find out leads, also exchange best practices. I'm joined here in this conversation by Venu Rajamony. He is India's ambassador in Hague, India's envoy to the Netherlands. Many thanks, Ambassador Rajamony, for joining us in this conversation. To start,
Smita, pleasure to talk to ETV Bharat.
Thank you so much. To start with, we saw all those reports playing out of Indian students, especially, who were stranded across airports in transit. Give us a sense now of what really has happened since then, and how is the embassy sort of reaching out to the community on a day-to-day basis?
Well, there was a lot of concern and confusion in the initial days when the lockdown began. And that was when we had a lot of people who were caught in transit, so to speak. We had about 115 Indians who were stranded in Schiphol Airport, Amsterdam, on the way from North America. And we had to charter a special flight. I had to take them to India. So after they had to stay in the airport for about a day or two with the embassy looking after them. Since then, things have settled down a bit, though concerns remains. People were waiting to see how much time or what is the directions from India with regard to resumption of flights. It has become clear that that is also going to be delayed immediately. There is no talk of resumption of international flights. So wherever there are people in distress, wherever there are people who are stranded without resources, we here in the embassy in the Netherlands and across Europe, our embassies are stepping up and supporting them with accommodation and food. Students, again, across Europe are being supported in different ways. Here in Netherlands, we have around 3,500 Indian students, and we are in close contact with them across different universities. What we find is that they are not in distress, so to speak. They are not in urgent need of food or accommodation. Their existing accommodation continues. They are making arrangements for food on their own. In a small way, the Indian community and the embassy is supporting them and supplementing their efforts. But their bigger worry is about whether they can go home, since a lot of education has shifted online, whether they can do their exams, their classes from India, for which flights have to resume. And of course, about continuing studies, academic year, changes, jobs after graduation, all the big questions which perhaps an impending recession brings to fore.
Right. As you said that the students have to undergo, the bigger questions are still there in terms of the academic courses, the changes, how will COVID-19 impact all of this? The issue of visas also. We saw a lot of the European citizens being evacuated from India, those flights taking place. What's your dialogue like on that front at this point in time with your counterparts?
I would say we have an excellent relationship with the Dutch government, and they have been extremely supportive. The Dutch government has made it clear that they are willing to extend the visas of anyone who's stranded or in a difficult position. Nobody wants physical contact, so everything is happening online. There is a link which is advertised, and people just have to apply on that link. And they are also available on telephone, and we get very positive feedback from members of the Indian community who have had a father or a mother or relatives visiting and have needed extensions, that the process is working very smoothly. So extensions are not an issue at all for the Indian community.
That sounds assuring, but in terms of the conversations that you and the other Indian envoys across the world have had with Prime Minister Narendra Modi during your video conferencing sessions, give us a sense of what really are, other than of course reaching out to the diaspora and taking care of the community, what are the other broad tasks, the challenges that all of you have been prepared to sort of face at this point in time? If you could share something on that.
Well, I think we have all been mandated by Prime Minister Modi to look out for whatever India needs, whether it be in terms of equipment or drugs or medicines, but also to see how we can support the countries where we are based, because across the world, everyone is dealing with this crisis and in different ways. Challenges are different. So we have seen the large number of medicines which have been sent from India to different countries. So there are places where India can step in and help, and India is doing that very much. We have also been asked to look at the long term, look at both the business implications right now and to see how we can support both Indian business and foreign business in India, as well as what are the changes, what is the post-corona world going to look like, and how should India prepare itself to seize to the opportunities which may arise, as well as confront the challenges which will continue to be there in the post-corona world.
Well, given all the uncertainties, of course, it's very difficult to crystal gaze anything at this point in time, Ambassador Rajamony. But, in terms of the business concerns, you said you had interactions with the community there, I'm assuming. What are their concerns that they might have raised in the India context at this point in time?
Well, the immediate concern from the community, a large section of whom are IT professionals, is just jobs, because there is such a huge disruption in the economy that there is a temporary, short-term impact. For example, the stoppage of flights it creates an impact on its own. KLM is one of the major users of technology from Indian IT firms. But in the long term, the IT firms themselves are confident that their prospects only improve, because so many firms are going to be looking at change management. So many people are going to look at how they will devise new methods of working, how they will adjust to a system where more and more people interact online, sit at home and work, deliver services just as they would have delivered if they were physically present. So all these changes which are expected in the aftermath of the coronavirus situation can create and will create opportunities also for our more agile, more nimble, more dynamic companies, especially our IT companies. And so people are preparing for those opportunities. Let me also say that a number of Dutch companies which have investments and business in India have approached us for help with regard to various supply chain problems that they have been confronting within the country. And we have been able to very effectively interact with MEA and with other authorities, both at the state level and central level, to help them resolve most of these issues.
Right. Also in terms of the best practices, I was just reading this report today, which said that apparently the Dutch authorities managed to detect genetic material from coronavirus at a wastewater treatment plant in Amersfoort on 5th of March, which was way before any cases have been reported in the city. So can you share with us some of the, is there any leads that you have at this point in time, either in terms of, what may be the advanced sort of warning systems, or the vaccines being worked elsewhere, or where all can PPE kits can be outsourced, can be sourced in from? Any of the leads that you may like to share at this point?
Well, what I would say is that I think the entire world is trying to find its way through the crisis. Nobody has a foolproof or a fail-safe method on how to handle it. And each country has adopted its own approach. Even within Europe, there is no one EU approach. Different countries have their own way of addressing the problem and tackling the problem. In general, what India has done and what India has achieved is being looked at with respect and regard, particularly the fact that we were very quick to impose a complete lockdown while the cases were still very small, and we have been able to effectively implement it across the country. I think the focus of much of the long-term efforts are on research, to see how quickly a vaccine can be produced, to see when cures for COVID, for the virus, can come about. And in all this, there is considerable work happening in the Netherlands, which we are reporting back to Delhi to institutions like the Indian Council for Medical Research. The Serum Institute of India, which is one of the largest vaccine manufacturers in the world, has a company here in the Netherlands called Biltuven Biologicals, which is one of the largest producers of polio vaccines and BCG vaccines, etc. So they, in collaboration with others in Germany, are also trying to support various aspects of research into a solution for the virus problem. The Johnson & Johnson, the American company, which is also being supported by the US government, has a major R&D facility here in the Netherlands, which is working on a COVID vaccine. So in the research area is where we find the most linkages, the most possibilities right now. But beyond that, I would say that the Dutch approach to dealing with the situation, dealing with the virus, has been different from most other countries as well as India. They call their approach an intelligent lockdown. The lockdown is not complete. The emphasis is on social distancing. People are encouraged to stay at home, work from home, but they can still go out as long as they go out only individually or in small groups of 3. So at some point, as we phase out the restrictions in India and move towards the different phases of easing the lockdown, I think there are a lot of lessons we can learn from the Dutch. But having said this, the numbers in Netherlands are still very high. And a lot of people, when they see the numbers, they are concerned. And the Dutch authorities themselves constantly reiterate that there is no room for complacency. They have extended their own restrictions till the 20th of May. And even after that, everyone across Europe is warning that the restrictions can be brought back if there is a sudden spike, as we have seen in Southeast Asia.
Right, and the number of affected cases may be higher there, but also the population sizes are just so different when you look at India and the Netherlands that I guess every country will have to decide on their own course. But just the last two
Absolutely.
questions.
The population sizes are different, but then the age profile is also very different. These are aging societies, so there is a higher degree of vulnerability. There is a high focus on the elderly and those who are ill in some way. They have more well-established infrastructure, health infrastructure, because of the being richer countries, being resourceful countries. But at the same time, they all are worried that the numbers can rise so fast that the health system will get completely overwhelmed. And health workers across the world are the front line. And I'm very proud to say that a number of Indians are also working in the health system here and providing exemplary service to the public and to society.
That's wonderful to hear. Just last two questions, Ambassador Rajamony. In terms of, the World Health Organization, lots of questions have been raised about its leadership today. We've also seen President Trump's reaction of withdrawing the funds as far as the US is concerned. What's the kind of dialogue that's happening there in Europe about it? What's the approach to this? Or are the Dutch authorities, government, worried to this kind of an approach from the US? What's really what things that you hearing?
Well, the Dutch Minister for International Trade and Development Cooperation put out a tweet where she said that she stands by what the UN Secretary General has said, which is that this is not the time to cut resources. Postmortems can be conducted later on what went wrong and what was right, but this is not the time to cut resources. So the Netherlands, as well as most countries in Europe, will broadly confirm to that line the lead being taken by the UN Secretary General that we should all marshal forces and all focus should be on dealing with the immediate situation and in tackling the virus rather than in cutting resources for WHO.
Right. And finally, in terms of the big elephant in the room, or China, in India, we are also facing a particular situation where so many of the rapid testing kits have been found faulty. In fact, the rapid testing has been put on hold for 2 days here. Is this a problem that European countries, that Netherlands may have been, facing? What's the dialogue around China at this point in time and holding it accountable for the epidemic in the days to come?
Well, I have to say that there is a lot of media articles and media speculation of various kinds. So it would be difficult to go into that. And there have been incidents of equipment coming from China which have been found defective and which have been rejected wholesale, and which has been talked about a lot, which is a matter of concern for society as a whole. But otherwise, debate within the parliament has more focused on investments and whether there is need to scrutinize and monitor investments in critical sectors such as healthcare. when at a time when the valuation of companies are very low and they provide opportunities for others to make predatory purchases.
Right. Okay, so that's something that, of course, we have seen moves around here also in India happening as far as the foreign investments are concerned. But many thanks, appreciate.
And in fact, if I can add, at the European Union itself, the European Commission itself has asked all countries of Europe to be on the watch and to monitor investments and to take necessary steps if required to curtail such investments which are not in the interest of the European Union as a whole.
So countries are, of course, on alert as far as possibilities of any hostile Chinese takeovers are concerned. These are days of uncertainty. And as you said, that a lot of things will play out, of course, going forward that cannot be predicted at this point in time. Really appreciate you finding the time to joining us for this conversation, Ambassador Venu Rajamony from The Hague. Here in New Delhi, this is Smita Sharma.
Thank you, Smita.